Hello everybody, good morning, good afternoon, good evening, depending on your time zone from where you are watching this video from. Thank you for stumbling upon this video and please make sure you watch till the end. Have you followed us on Facebook? Have you subscribed to our YouTube channel? Please do well to like, comment and share, and don't forget to hit on the subscribe button and also hit on the follow button. Remember, follow so that you will always be the first to know whenever we drop a new video. What are you waiting for? Like now, comment, share, follow and subscribe. Back to basics. On today's video, I will be talking about cleft lip and cleft palate. Cleft lip or cleft palate. Do you have a child with cleft lip or cleft palate? Just so you know that he or she would require an increasing number of treatments and assessment as they grow. Now, the big question is, what is the difference between a cleft lip and a cleft palate? A cleft lip is a birth defect whereby the upper lip doesn't form completely during pregnancy and there is an opening in the upper lip. The opening can be here, it can be here, it can be here. Just know that there is an incomplete formation of the upper lip during pregnancy, and when this child is born, there is a birth defect on the upper lip. Don't you also forget that the lip is formed between the 4th and the 7th week during pregnancy. So, like I said earlier, the lip forms between the 4th and 7th week of pregnancy. The 4th and 7th week of pregnancy. In the other hand, cleft palate is also a birth defect. But in this case, it is the roof of the mouth that doesn't form completely during pregnancy. It is the roof of the mouth of the baby that is incompletely formed and it has an opening in it. That is for cleft palate. The roof of the mouth is formed between the 6th and the 9th weeks of pregnancy. If by this time frame there is an incomplete formation of the roof of the mouth, then your baby would be born with a birth defect known as a cleft palate. We have a common term for the cleft lip or cleft palate, which is known as oral cleft or orofacial cleft. Orofacial because it has to do with the face. Oral, mouth. Facial, face. You see the combination of the oral and face. So just set your mind on cleft lip or cleft palate each time you hear the word orofacial cleft. Now, what are the difficulties faced by children with clefts? These children will have difficulty with speaking, difficulty to hear, meaning that they will have hearing difficulties because they have glue ear. They tend to have glue ear. The term glue ear it simply means that there will be a buildup of fluid in the ear, a buildup of fluid in the ear. Just imagine when there is a buildup of fluid in the ear, it means that you have difficulty in hearing. You might be here, I'll be shouting at you, calling out your name, but you wouldn't hear. Even when I speak to you softly, you wouldn't hear because there is a buildup of fluid in your ear, and it will give you much difficulty for you to hear what the other person who is even close by you is saying to you. There will also be teeth problem. There might be a missing tooth or even an extra tooth. Yes, there might be some missing tooth or extra tooth, meaning instead of when this child is completely grown, instead of having 32 set of teeth, there will be an extra or some might be missing. Now, let's talk about the causes of orofacial clefts in children. What are the causes of orofacial clefts? Cleft lip or palate happens as a result of changes in the genes of these affected children. So maybe there is a mutation in one gene or the other of these affected children, then cleft lip or palate would occur. Plus factors such as what the mother ate or drank during pregnancy, or maybe she must have taken certain medications, maybe let's say certain medications for epilepsy, or the mother was diabetic during pregnancy, maybe she must have taken one or two drugs either for epilepsy or for diabetes, or even some factors like what the mother must have been exposed to in her environment, or some environmental factors, what she must have been exposed to, what she must have inhaled from her environment or during pregnancy. Even the Centers for Disease Control and Prevention, which is the CDC, in one of their research studies, they reported that smoking, diabetes, could be a contributing factors to cleft. So they carried out this research, and the findings show that there were more cleft in the babies of smoking mothers, the mothers who smoked during their pregnancy, than in babies whose mothers didn't smoke during pregnancy. And they also did it and found out to that the same reason for diabetics, that there were more clefts in babies whose mothers had diabetes during pregnancy, more than in those whose mothers did not have any diabetes at all. Diagnosis for orofacial clefts. How is a cleft lip or a cleft palate diagnosed? A child can be born with a cleft lip, with or without a cleft palate. You can have a child now, a baby now, the baby might have just cleft lip, but some babies might have the cleft lip and cleft palate at the same time. For the cleft lip, you have to diagnose the cleft lip during pregnancy through a routine ultrasound. There is something we call ultrasound. That is how a cleft lip is diagnosed during pregnancy. But some cleft palates can also be diagnosed after birth. After you've given birth, you find out that is even when your doctor is diagnosing your child with cleft palate. There is another type of cleft palate which we call the submucous cleft palate and the bifid uvula. These ones might be difficult to be diagnosed early in life, so they are diagnosed later in life. Diagnosed later in life. Is there any other way I can break this thing? Let me say this. There is another cleft palate, another type of cleft palate, which we call the submucous cleft palate or the bifid uvula. You see, these ones you can't just it's difficult to diagnose them early in life, so they might be diagnosed later in life. I hope that was simple enough. Now let's talk about the treatments of orofacial clefts. How is orofacial clefts treated? How is cleft lip or cleft palate treated? Remember that the general term for cleft lip or cleft palate is commonly known as orofacial clefts. So how is the orofacial clefts treated? You just have to know that the management of children with orofacial clefts vary depending on the severity, the age, or even other birth defects. Because these children, they tend to have other birth defects. So we have to put that as a big factor to how they'll be treated and managed. A surgical repair of the cleft lip is done under a general anesthesia. What do I mean? This child will be injected or to make the body numb for this operation to take place so that he or she wouldn't feel what is happening, he or she wouldn't feel pain. So we call it a surgery under general anesthesia. Okay, and this surgical repair of the cleft lip usually takes place within the first 12 months after birth. Within the first 12 months after birth. And for cleft palate, the surgical repair should be taking place at least within the first 18 months after birth. For cleft lip, within the first 12 months after birth, and for cleft palate, within the first 18 months. Within that period, that's space of time, within it can even happen before that 18th month, but within that period of 18 months after birth, that is when the cleft palate surgical repair for the cleft palate is carried out. So do well to care for your child. Do well to always remind your doctor. Doctors are busy. Those people who carry out the surgeries are busy. Do well that you know that your child has got this facial deformity and he or she is going to be telling you, oh mama, what happened to my face? Oh mama, what happened to my this? Oh mama, what happened to my lips? Mommy, what happens to my palate? So know that this child will have to undergo a surgical repair of the cleft lip or cleft palate. These children will need a rhinoplasty to improve the shape of the nose. They would also require a special dental care. They will need a speech and language therapist. They would also require a special orthodontic care and treatment because a lot is happening with their teeth, with their body. They need everything. They need all these treatments to improve their look, the rhinoplasty, to improve the shape of the nose. These children will continue to be monitored until about 21 years of age, when presumably they might have stopped growing. So you continue to monitor these children, speech, you monitor their dental, you monitor everything about it, everything. Just monitor. Not you who is monitoring. This child will have a special medical team who would be assessing them, managing them, check everything about them, just to make sure, if anything is growing in a very awkward way. They will continue to monitor even their teeth, everything about them, their hearing, if now their hearing is okay or there's still difficulty in hearing, their speech. They will have speech and language therapists. Yes, they will have all these things. Now let's talk about feeding. How do you feed babies with oral cleft? How do you feed babies with orofacial clefts? As we said earlier, babies with cleft palates, they have an opening in the roof of their mouth. Now, when you try to feed this baby, the gap in the roof of the mouth of these babies with cleft palates makes breastfeeding difficult for them. They suck in air. When they suck in air, then milk comes out of their nose because they find it so difficult to form a seal on the nipple. So their mouth can't form a seal on the nipple. I don't know how to explain this to adults. Have you tried to suckle on your mother's breasts? Or have you taken out time to watch a baby who is sucking very well, a baby who latch on the breast? Just watch the baby. The mouth forms a seal on the nipple, and this baby could suckle on the breast very well. So this baby with a cleft lip cannot latch on the breast because of this gap in the roof of the mouth. So the mouth of this baby can't form a seal on the nipple. So when this baby sucks on the breast, he or she is only sucking in air, and the tiny milk that he or she sucks will just start coming out from the nose. So if you are a parent of a child with orofacial clefts. Yeah, just so you know that your baby's medical team would recommend a special cleft palate bottle for your child if he or she is unable to latch on the breast. Don't start to panic. Oh, my baby can't feed. Oh, my baby is gonna is gonna go thin because he or she is not feeding. No, your baby's medical team knows the breast, so they will recommend a special bottle which we call the cleft palate bottle. So this bottle will help your child to feed properly. But one thing you have to know as a breastfeeding mother is that you have to feed your baby in an upright sitting position. I repeat, upright sitting position in order to prevent the backflow of milk into the nose area. So you know when there is a backflow of milk into the nose area, that is when milk will start coming out of your baby's nose. Make sure that the feeding bottle is tilted for the nipple to be filled with milk. You know, there is a way you tilt when you're feeding your baby, there's a way you place your nipple in the baby's mouth and the mouth will form a seal. So now when you're feeding with the bottle, it's still the same way. We will advise you to sit on the armchair in an upright sitting position so that you relax your arm while feeding the baby. So now when you're feeding with this special cleft bottle palate, this special cleft palate bottle, now I'm beginning to speak Spanish. So what you have to do is to make sure that this feeding bottle is tilted so that the nipple, when I say nipple, remember that bottle, the part the baby suckle on, we still call it nipple. It's not just your own nipple. That bottle where the baby suckle on is still called nipple. So you tilt the bottle and make sure that the nipple is filled with milk, and when it's filled, you also make sure that when the nipple is filled with milk, that it is pointed down away from the cleft. When it is just on the cleft, what will happen? The baby will find it so difficult to feed. The baby will be crying and all that, so it will also be difficult for the baby to feed. So make sure that when the nipple is filled with milk, it is also pointed down away from the cleft. But don't you forget that every child is different. Every child is different. So in some cases, it is difficult for these babies to latch on the breast milk. They find it difficult to suck on the breast milk, and they also find it difficult to feed using the special cleft palate bottle, which is recommended by this baby's medical team. But the last result is by feeding this baby using the nasogastric tube, the NG tube. You feed those babies using the NG tube when they cannot feed, either using the special cleft palate bottle or to suck on the mother's breast. So we feed them using the NG tube. Okay, my people. Just if you have not followed us, if you've not subscribed to our YouTube channel, if you have not liked this video, if you've not commented on this video, and if you have not shared on this video, please do that right now. Do that right now. Do that right now. Please stay tuned and turn on the notification bell so when we drop our next video, you'll be the first to know. Until next time, it's your girl, Nurse Princess Siva TV. Bye!